Hi, my camera's acting crazy today. It turned on before I touched anything a little while ago, and now it worked the first time, so I'm nervous. And also, uh, I'm sure my light is going to go out any minute because that is simply how today's going. I've had quite the day. Actually, it's like 5 o'clock at night or in the evening. I usually do this in the morning, but I I went into my daughter's room this morning and I thought I'm just going to clean a little bit. And then 2.5 hours later, I was late for the rest of my day and had to change all my appointments. And my throat still hurts from the screaming. I don't know. I don't know what's happening in there. I found granola, just like a granola bar that she must have chopped up into little pieces and sprinkled all throughout her bookshelf. Every book I took off the shelf, it rained sticky granola. I know God's just trying to teach me, how not to be the anoretentive, obsessive compulsive lunatic that I am. But I don't foresee myself changing. I think if anything, I'm going to look forward to the empty nest. I love my children more than anything, but I feel like I will love them more when they don't live in my house. Okay, so I don't know how long I have to go finish that room because it's her desk is just, oh my God. Anyway, okay. So a couple little things I got from PAT this week. And I don't know what people think. I don't know how their brain works or what they get. And I know a lot of you have gotten this. I'm sure they have. People really do think that a stroke has something to do with their heart. They really do. They think that you can have like a cardiac stroke. This patient under the cardiac portion wrote down that she had a stroke. I'm like, I mean, you can have an ocular stroke. There are areas, like even, like a renal. Even then, it's not called a stroke. I don't know. It's just a stroke is in your brain. A stroke is in your brain. Stroke is like above the neck, let's say. At any rate, it takes a while to decipher actual problems that we need to do something about, and the fact that we can't do anything about the fact you had a stroke 2 years ago. It's not going to change anesthesia or what we do about it. Also, people think anesthesia is like a big syringe filled with anesthesia and they're allergic to it, or they have a problem with it. That's not. Anesthesia is like 20 different medications. It's not a thing. It is a process to get you to have ana, opposite of anesthesia, sensation. That's what anesthesia is. There's local anesthetics, there's sedation, and then there's a general anesthetic where you don't feel anything and we can, do whatever we want. And it's not like one medication you can be allergic to. And it drives me insane when people think that they're like, oh yeah, I'm hard to wake up. Yeah, a lot of people are hard to wake up. That's good. That means you're not a drug addict. I don't know what to tell you. That's not a problem. That's a good thing. And I wish we didn't even have to ask them that. I don't know how anesthesiologists do it. God bless them, how they have to go in there and listen to the most ridiculous things people say because they truly don't understand at all anything about anesthesia. Like they scheduled their procedure 2 weeks ago, didn't spend 5 minutes looking up what they're going to do or what anesthesia is or how it works at all. But then they're going to try to bombard you with 100 different ridiculous questions completely unrelated to what's happening the day of 10 minutes before their procedure. I don't understand people. I also had a patient tell me that they're on a non-narcotic muscle relaxer. I don't know that there's, I mean, maybe there's such thing as a narcotic muscle relaxer, but they're not they're not the same thing. A narcotic is a narcotic. It stops you from pain receptor sites throughout your body from accepting that signal. And a muscle relaxer relaxes the muscle, stopping the firing of the contractility of the muscle. They're not related. Just because you have like some muscle relaxing effects or feelings from a narcotic doesn't make it a muscle relaxer. Valium, that's a skeletal muscle relaxer. Just because it makes you calm and relaxed and helps with anxiety, that doesn't change what it actually does. Um, I had another patient, I guess, that had a full page of meds and told me this. Yes, she had a full page of meds, the whole works. She even wrote down that she had CHF, but she's never seen a cardiologist. Her PCP is managing her CHF. That sounds fine. I'm sure it's fine. It'll be fine. And also what I noticed, I listen to a lot of YouTubers, like a lot. Like, I don't know what I would do if I suddenly couldn't listen to YouTube because I'm so addicted. It's mostly true crime, as I've said in the past. And I'm listening to a lot of them, and they're young. Most of them are young. And this one guy, he's, in the military, very intelligent. They're intelligent people. They're educated. Some of them even have, one of them has like her criminal justice degree. Another was a lawyer. They're not dumb people, but the stuff they say is so painful. Like, he was telling the story. He's like, so then, in the emergency room, the nurse came over with a syringe to draw her blood. I'm like, no, that's drug addicts put a syringe in their arm. Nurses use vacutaners. That's not, we don't, I mean, maybe there's a time when you would, I don't necessarily, well, like to start an IV, some of our anesthesiologists, or we'll start an IV and then hook a syringe up to it to draw back and then put it in a vacutainer bottle, just via a regular needle, because we don't have like we're not going to use a vacutainer needle that screws onto a hub, because you need that adapter, and we're going to use that as an IV, so we just kind of draw it out and then hook it. But in the situation he was talking about, that's not at all. And then the whole thing was like, and then when they drew and you may have heard of this particular story, it was really bizarre. They drew the blood out, and then it once it hit the atmosphere and cooled off, there was a gas in the air that killed everybody in the room. And I had put on there, I'm like, none of what you're saying makes sense. That blood is trapped in a vacutainer vial. It can't get into the air and mix. And I guess this lady was taking DMSO for whatever treatment that she needed. And there's nothing wrong with DMSO. I use it all the time. It's a good product. I have to use it correctly, and obviously use it correctly. I don't know what it's used in humans, but I did use a mixture of it, and I don't care what anybody says. I know for a fact that helped this tumor go away in one of my horses. But at any rate, just like the things they were saying, I'm like, and I'm reading through the comments thinking I can't be the only one that realizes what they're saying doesn't make any sense, but they were all like kind of on board and stuff. And I'm like, if you drew blood and it stays in a vial, like even if you opened it, it doesn't become a gas. I don't know. I don't know. Ignorance is bliss. Okay, so some stuff that people wrote down, I'm just going to run through a little bit, and then I gotta go try to finish that room, and then I have 2 hours of work at the barn, and then I gotta do my hour and a half routine before I can go to bed and get up at 2:30 to do it all over again. This is not what I intended. Okay, so one student charted that they had a nasosaline IV. You heard me right. A nasosaline IV. What is that, you ask? I don't know. All I can tell you is this is what y'all write, and it is precious. Band-Aid to right lower lobe. Probably earlobe. Do you think that was a Band-Aid on their earlobe, maybe? Maybe a chest tube came out? I don't know. I don't know either. Possible MI dementia. That is a tricky diagnosis right there. A possible MI dementia. It's myocardial infarction with a side of dementia. ER diagnosis, gasitis. 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 That's inflammation of the gassa with the titus. Multiple economics areas. Multiple economics areas. I know what you meant, but I'm not going to pretend like that wasn't precious. +1 non-pitting. All right, we've had that before. Impaired gas exchange related to BPH. I don't know how big this prostate got, but if it is impairing this gentleman's breathing, you need to call 911. Have you ever seen Johnny Dangerously? Okay, go look at that. Go watch that movie. Fabulous movie, and it's elephantitis of the testicles may affect your breathing. Hysterectomy ×2. Okay, I get this a lot. I get this a lot. And I may need to really look up the definition, but here's the thing. A hysterectomy it's just the one organ. That is your uterus. When your uterus is removed, That is a hysterectomy. Now, when they say partial, I believe that just means like they left the cervix for whatever reason. I don't, I don't know how it's attached. I've never been in there. I don't do that kind of general surgery. I haven't seen it. But when they say like a partial hysterectomy, that still doesn't matter whether it's a partial or a half hysterectomy. If your uterus is gone, you don't have to pee in a cup. Like in my world, that's all that means. If your uterus is gone, I don't have to worry about you being pregnant. That's all that matters. You can't have more than one. Now, there are some things that kind of grow back a little bit. I've heard like tonsils growing back over 20 years and they had to have them, removed again, or that gland, swells or whatever it is, if all the tissue wasn't removed, I don't know. But you just have the one uterus. Unless you were born with two, which happens. It's probably unlikely, but it happens. But you can still only have it the one time. And whether you tell me you had a partial or a full hysterectomy, full meaning still just a hysterectomy. If you want to add in there the salpingectomy, oophorectomy, and your ovaries and tubes, that's not a hysterectomy. Those are different structures entirely. Nobody understands that. And I feel like you, as a woman or even as a human, it would be great if you knew your anatomy like a little bit, just a little bit. I mean, you don't have to know what gland secretes what. I don't. But if you just had a little idea. I did work with a nurse, and she's a very intelligent nurse, but she did write this once, and I couldn't help it because the other nurse and I giggled like crazy. There's Tylenol arthritis, or as she wrote it, arthritic Tylenol. Arthritic Tylenol. When your Tylenol's all arthritic Tylenol. Oral mouth cancer. That is miserable. The student charted that the patient was diagnosed with oral mouth cancer, as opposed to oral butt cancer. Oral mouth. That's the word oral leads you to believe we're in the mouth area. I think a patient may have said these to me. Not the students are pretty good with this, but the patients can't get it at all. Atrial, I've gotten fibrillation, and I've gotten fibrillation. They never know what that means, and they can't ever say it correctly. Students sometimes spell it wrong from time to time, but they still. I had a patient the other day says, "Yeah, that's where the blood drips." All right, I mean, kind of. That's in essence. Patient was given Dilaudid 0.5 milligrams IV for tolerating MRI. That's what the student wrote. So as a treat, because the patient did so well with their MRI, they rewarded them with 0.5 milligrams of IV Dilaudid. That's the way it's written here. Good boy. They were out of cookies, so he got some Dilaudid instead, which I think is a good trade-off if you ask me. Abdomen, bowel sounds, present times, 4 quads. Abdomen, bowel sounds, present times, 4 quads. All right, that's in case you're wondering where the bowels were. They are, in fact, in the abdomen, but recognize that those are two different things you're charting there. The abdomen is soft and non-distended, or soft and round, or soft and concave, whatever you want to say, or flat. And but the bowel sounds are the ones that are present, but still good stuff. Skin warm, dry, brown, and intact. All right. I mean, you can be as detailed as you want. I don't believe that they are referring to race here. I believe what they're saying is that they probably have that brownish discoloration on their shins, like when you can tell someone has PVD, diabetes, poor blood flow. I'm going to bet that that's where they were going with that. Ooh, bone contractures. Oh, gosh, when the bones contract, they get all contractured, the bones could, that's not a thing. That is a sweet little student not remotely understanding what a contracture is. Soft tissue contracts, bones, not so much. No pedal pulses because amputated limbs. All right. It's not that there's no pedal pulse, it's that there's no pedals at all. So you're not looking for a pedal pulse, you're looking for the most distal pulse. So if that is below the knee amputation, you're looking for a popliteal pulse. If it's above the knee, you need a femoral pulse. You still have to get a pulse. You can't just let it fly. Like, I'm sure these got some perfusion. Rhonchi lung sounds. All right, we're missing just a bit there, but all right. Partially indentured. You think that's a servant? It's an indentured servant. They're almost done with their service, partially indentured. Okay, so I believe what they're referring to as someone who is an edentulous, which means no teeth, but this guy has some. Still, don't have to count them, but you need a little more than this. Speech gargled. Oh, the old gargled speech. You know, when they're like, yeah, that's not so much how we describe speech, but still good stuff. Enjoying that. I'm going to draw a little line here so I know where we left off for next time, because I got to get out of here. I'm too freaked out about what that room holds for me. I have her doing it, which we all know. She just is going to stuff everything in another place, and then I'm going to find it like I did earlier. I literally used a rake, like in Mr. Mom, to pull everything out from underneath the bed, the beads and the rubber bands and the wrappers and the pieces of what I believe was chocolate and gum and dried slime. And I'm gonna have nightmares. I'm gonna have nightmares. I am gonna remember to. I forgot to do this, so I'm gonna do this one. This is one of my favorites. This is a patient who got, or a student who got in report that the patient, you know who you are, don't give yourself up. The patient had COPD with HOMO2. Do we all know what that means? COPD with HOMO2. The way the student charted it was HOMO2. Now, not that that wasn't one of my favorite things ever, but what I really liked about it is that she tried to Google it. What do you suppose came up when she put in HOMO2? I'm very curious. But I'm going to bet nothing that had to do with oxygen via nasal cannula at 2 liters per minute. I think that that's probably not what came up. But still very entertaining. It's one of my all-time favorites. That was precious. So we'll see. Next time we'll pick up where we left off here, and I have I don't know, maybe 400 or 500 more pages. So we'll stay entertained. Meanwhile, hope all is well, and same as always. Face your fears, forget your failures, follow your faith, and to pray for me, would you? Because I'm got a little dumpster fire going on over here. It's going to be fine. Everything's going to be fine. It's going to be fine. And so will you. All right, see you next time. Think that could possibly shut off at the right time. Wouldn't that be good? If I just said see you next time and then it shut off? You piece of I feel like Phoebe with her fire detector, smoke detector that wouldn't use, son of a...